I'm Donna Hanover. Scientists are hard at work finding ways to keep our skin both healthy and beautiful. But figuring out what's real and what's hype isn't easy. Today we'll take a look at the truth behind the science of the skin. Dr. Alexiades-Armenakas considers it her foremost duty to help patients fight skin cancer. But this Harvard-trained scientist, who was originally a sculptor and portrait artist, also helps people with their appearance. What is it that makes our skin look older?
It's typically due to changes in elastin over time that causes sagging of the tissue. And the other main cause of skin aging is sun exposure. In that case, aging manifests as the accumulation of wrinkles, brown spots, broken capillaries, and abnormal growths.
She says the original lasers for skin resurfacing ran the risk of infection, scarring, and lightening of the tissue. But now stem cells in the skin can be protected with Fraxel devices like fractional radiofrequency, known as E' or evolastin. Dr. Alexiades-Armenakas was the lead investigator for the FDA trials.
E' and evolastin are a huge step forward for a number of reasons. The energy of the device is released here into the second layer of skin, and that is what turns on the collagen-making cells and the elastin-making cells to generate new collagen and elastin. And by the way, the results accumulate over 1 year. So what happens is you look younger and younger and younger over the course of a year. Up until now, the reason we didn't get like the phenomenal results that we wanted to was because we didn't want to have the risk of a burn to the epidermis or the outer skin. By putting the energy into the tissue using very fine hair-like needles, we bypass the skin surface and keep that safe. Here's the handpiece. The needles come out of here on the tip, and this is what goes onto the skin surface, okay, to treat. You want to achieve 150 insertions minimum. The needles are programmed not to fire if they're in the wrong location. If it's in the hands of a laser specialist, it has safeguards in place that make it much safer, much safer than a lot of the other technologies that have come through.
In blind studies, a half-hour treatment was shown to give a third the benefit of a facelift without the patient ever going under the knife.
Here's a perfect example of a patient who at baseline has both wrinkles and skin laxity. And you can see that the neck is starting to get redundant, so she's having some jowling and redundancy in the neck.
What is causing her to look better 3 months later?
There are two main factors. Evolastin is increasing the amount of collagen, and that's what's decreasing the wrinkles. But number two, it's increasing elastin, and that's what's tightening the jawline and tightening up the sagging of the tissue. And the results last, because I did the original trials back in 2007, and those patients have maintained those results. So it's not like it's something that wears off. You are permanently younger looking for the rest of your life.
E' is not for everyone. For people with sun damage but not much sagging, there are other energy-based treatments, and injectables are an option.
There are two main types. So what Botox does is it weakens the muscle so it can't make those frown lines. And as a result, it gives the skin a chance to replenish that area, and actually those wrinkles get to diminish over time. The other is what we call the fillers. The safest and by far the most highly used fillers are what we call hyaluronic acid fillers. When we started with fillers in the 80s, the work was done with bovine collagen, collagen from cows. Nobody uses that anymore because of risk of allergy and other such risks. We then started to use a human-derived collagen. That's also not used that much. It just doesn't last long enough.
She's created a cream called 37 Actives based on her research, but says whatever you apply, try to make sure the chemists have used something like liposome bubbles to encapsulate the ingredients so they won't be diminished by oxygen as soon as the jar is opened. You can also get a lot of these substances internally by including leafy green vegetables, berries, red grapes, green tea, and either fish or flaxseed in your diet. And 8 glasses of fluid daily fights dehydration of the skin. Doctors say that looking a little younger often makes people feel younger, and so they engage in more physical activities that keep them vibrant. It turns out that the pursuit of beautiful skin can have benefits far beyond the chance to look a bit more glamorous. I'm Donna Hanover for Science and You.